It is really tough breaking bad news. There is a risk of the back of the eye retina to detach, and that causes blindness.
One of the advantages of being a GP is to have that long-term relationship with patients.
I've got to last until my Charlie gets through medical school and graduates.
Okay.
If you can make people smile or laugh, they're able to relax in your presence. That is just the most disastrous looking toe I've ever seen.
Looking at your ECG,
Yeah.
I think we still need you to be seen in hospital today, okay?
Barnum Surgery's been to Pam. How can I help?
Hello, darling. Come in.
Thank you.
You saw Dr. Bulger, didn't you?
did,
Yeah.
yeah.
And she's put on here we need to repeat your liver function.
This is the best one.
That's good. Oh, yeah. It's a whopper.
Yeah.
I like that.
As long as you leave me some.
Has nobody seen this yet? Has anyone seen it? No.
No. It doesn't bother me, except if I touch it there, which is the point of contact with the floor.
Yeah. I don't check the faces, but
No.
I'd be inclined to put you in to see the emergency doctor this morning.
Maybe you'd better check it out.
I would prefer to, have the doctor have a look.
OK.
All right, me darling. Nice straight arm.
No, he's parked right in the middle of the car park. I couldn't get into any of the spaces.
Oh,
He won't move because he's waiting to pick
what in
me
here?
up in the doctor's car park.
Oh.
Emily Angel, please. Hello, come in. I'm Dr. Sheikh. Have a seat, please. Right, how can I help?
Yeah, we were here Monday.
Yeah, I did
and
see
she
that,
had the
yeah.
rash, it was just on her tummy.
Yeah,
And we were prescribed Piriton.
Yeah.
Told to just do 2 meals twice a day because she's not really supposed to have it yet.
yeah,
But it's not working, and the rashes, as you can see, it's all over her face, her arms,
yeah.
legs,
Well,
feet,
just still
and
smiling,
everything.
yeah. Okay.
And he did say if it gets worse to come back, and it's
Okay.
obviously got quite a bit worse.
Shall we have a look? And feeding-wise?
She's been okay with her milk, but not so much actual food.
And having wet nappies, that's normal, yeah.
Wet nappies.
Okay, why don't you take off all her dress and accept the nappy?
Okay.
Okay.
Yeah.
Yeah, you hold it and I'll have a look at you. Okay. Apply pressure, they disappear and then they come back.
Yeah.
Now you want this toy, this is mine. Yeah? You want to be a doctor? You want to grow up and be a doctor? Okay. Okay, so you can dress her back before she gets too cold.
Yeah.
The rash that she has got doesn't look like an allergic rash. Okay, so you can stop the Piriton actually,
Okay.
right? So it's not a worrying rash. She's well in herself. She's not got a temperature.
Yeah.
If the rash changes in appearance or if you're worried for any reason, bring her back.
Yeah.
The only other thing I wanted to mention, while I was having a listen to her chest, I did hear a little extra sound in her heart, okay, which is nothing to worry about. Again, we sometimes see this, which we call as an innocent murmur.
Yeah.
Sometimes babies, when they're unwell, they get a murmur and then it kind of, resolves on its own. But I don't want it to be missed. So I'm going to write to the pediatricians to have a look at her.
Okay.
High five?
High five.
Do you feel reassured? Yeah?
Yeah, it's fine.
Okay.
Thank you very much.
Do you want to hold that? Yeah. But don't
eat
tear
it,
it
though, won't you?
and don't eat it. Yeah. You're welcome.
Thank you very much.
All right, you take care. Bye-bye.
Bye.
Come on in, Sarah. I'm Dr. Bulger. We've met, I think, haven't we? Okay, so how you doing?
Levels are still there everywhere.
Right, because we... have you had bloods done or not? Here?
Not recently.
No, the last one we've got is horrible, but it's a long time out of date. You're due some more, aren't you?
I think so, yeah.
Yeah, okay. And they are everywhere, aren't they? So they're all... There's loads of 20s, yeah? There's no lows that I can see there. Are you having any hypos?
I had one just before I come.
Today?
Yeah.
Right. Are these any better than they've been?
Yeah, it's everywhere still.
Okay. You know that I need the diabetic specialist to have a look at you for this, yeah?
Yeah.
And we need them to see you sooner rather than later, don't we? Tell me how much insulin you take.
Well, I take 11 minutes in the morning, and then I have like between 18 or 24 or 26 of the Humalog with the 11 in the morning.
And then at lunch?
It's about 24, 28. I put it up to 28 lately.
And what about your evening meal? Is that your big meal of the day?
Yeah, if I have that, I take about 30 of that.
Are you not eating regularly?
No, I've gone off my food for about 3 months now.
Do you know why?
I'm suffering from depression as well.
Mm.
He had a bit of an accident at the weekend.
Did you trip?
No, I just didn't realise my step was that big.
I did go backwards and forwards, and I said, ow, that hurt my back.
What happened?
That, well, apparently I don't remember going from the top of the stairs to the bottom, but apparently my manager said that I'd fallen.
Oh, you had a fall. Oh, dear.
I fell downstairs.
At home? Oh, gosh. Come on through. How can I help?
Well, I fell and down my...
Yes.
Everybody says I have to have it checked out to see.
When did you fall?
On Saturday.
Saturday. What happened?
Well, I was coming down the escalator in the shop.
Yes.
With a trolley to turn it round. Of course, the escalator doesn't stop.
Of course.
It keeps going.
Yeah.
Taking me with it.
Oh, bless you.
And I couldn't stop myself.
Is it painful?
It's only if I touch it. It's not that painful now.
Yeah.
You know, the pain dies down. But I saw a chiropractor yesterday because I see them for my arthritis. And then I saw the nurse this morning to give my blood sample, and she said, I think you should have it done.
Oh, all right.
So
fair
they
enough.
both said, have it
Have a
looked
little
at.
look. Because you're on aspirin, aren't you?
Yeah, that's why I'm
that
all
sore?
black and blue. Yes.
A bit sore there.
Yeah.
There's no bleeding from the nose or ears or
No,
anything?
no.
Good.
Ow. See that? I think it's the cheekbone.
Yeah.
Actually, it's probably bruised. You know, something like that.
It's all bruised around here.
Yeah.
Bless
No,
you.
doesn't look awful. And it'll take ages to get better.
A few weeks.
I know it will.
You didn't lose consciousness when you fell.
Oh no, no.
Other side. Okay. Good. I think it's just badly bruised.
Do you think so?
Yeah, I don't think you've broken anything.
No, that's what.
But because you're on aspirin, it does make you bruise more easily.
Yeah. Thought it might beauty completely.
Oh, I know, you poor thing.
I think I had them bad enough to start with.
It will get better. We just got to be patient.
Eventually, yes. Anyway, I'm sorry to take up your
No,
time,
no,
but it
not at
wasn't
all.
my fault.
Better safe than sorry, though, eh?
Well, I suppose so, yeah. Anyway, thank you very much.
That's all right.
Yeah.
Take the lift, okay?
Okay.
Don't want you falling down the stairs now.
Bye-bye then.
Bye.
You don't like your dead, Mum?
Huh?
You don't like your dead?
I'm really tired. I'm really tired. I was in bed at 9 o'clock last night reading my book, and then Dad drank a full bottle of wine, which made me cross. He then fell asleep, missed the football, and it was my favourite that I'd had half a glass out of, so now there is none of my favourite. It's beautiful, beautiful Shiraz, and then I went down to get a glass and he drank it all, and that was 8:30. No, I told him to stay downstairs because I wasn't putting up with him nonsense snoring, but he came to bed, so I went to bed in a mood.
What are they doing about your depression?
I'm on 40 mg of citalopram at the minute.
Have you had any talking therapy?
Not yet.
Would you like to? Is there anything going on that you need to talk?
No, I'm just not motivated to do anything. I don't know what, but in particular.
So there's nothing particularly worrying you? Would you like to talk to anyone about the diabetes? Because that can be tough, living with a long-term illness, can't it?
Not really, I'm just fed up of it being high, but I guess everyone gets fed up.
Some people find the confines and the complications of something like diabetes very difficult to deal with. It's a lifelong diagnosis and it affects nearly every aspect of your life. Having a chronic condition makes you depressed, and being depressed makes managing a chronic condition much more difficult, and the two are very definitely linked. I'm going to send you back to the diabetic clinic. There's blood tests on the system. Will you book them for me, yeah? Here, yeah. In fact, let's get you a blood test now, and then I can send you back to them when I've got the new results, yeah? If you change your mind about talking to someone, if you change your mind about talking to anyone around the diabetes, you get a message to me? Are you seeing anyone again about the citalopram?
Not that I know of.
What about hurting yourself?
No. But I had a hypo fit at the end of March.
Sarah had several admissions which have been directly related to her uncontrolled diabetes. Hypo is when your blood sugar drops. So if you think about when you feel really hungry, that horrible empty feeling, but magnify it so people feel trembly, shaky, sweaty, often become confused. In its most extreme forms, hypoglycemia will lead to coma and, if untreated, to death.
I don't have the intention to hurt myself, but if something like that happens, so just let it take its course, basically.
That sounds horrible. You've been diabetic long enough to know that if you're not looking after yourself properly, then you are at risk of hurting yourself, aren't you?
Not being able to eat, but I'm forcing myself to eat now.
Not taking control of diabetes, not managing your diet, it's self-harm by neglect. So diabetics who are struggling with motivation will often say that they wouldn't deliberately do anything to hurt themselves, but sometimes they really just can't be bothered, and they're aware that that will then have an impact on their health. What should we do next? What could we do next to help with that? Why not talk to someone?
Not really anything to talk about it before, and just fed up.
You think it's tied into diabetes? Might be an element of chicken and egg, mightn't there? You're feeling rubbish, so it's hard for you to keep on top of your diabetes. Your diabetes is rubbish, so that makes you feel depressed. Will you come back and see me after those blood tests? And will you stay on the citalopram until then? And if you change your mind about talking to someone, will you let me know? You don't have to wait for the appointment to do that.
Okay. Just phone up and say, can I go to Dr. Bulger?
Yeah, just phone up and say, I'd like Dr. Bulger to give me a ring. And we crack on and we get the diabetic people to see you and try and bring your sugar down. Does that sound like a reasonable plan? I will expect to see you in a couple of weeks, yeah?
Yeah, that's easy.
Bye-bye.
Can someone grab me some paper towels? Lady's collapsed in the street. Sheila's with her. I think they're going to be okay. They're going to bring her in. Thank you. Thank you.
Hello. How are you today? I understand you had a panic attack in the workplace, is that right?
I was on my way to work.
Oh, okay.
I don't know what happened. I was fine in the morning. Dropped my kids off as per normal. I was driving. I started to feel my legs just started shaking. Hot and cold flushes. I could feel my just chest and everything just burning up. And then my hands just started to freeze. I couldn't change a gear, so I just pulled up. And then I called my manager, who then, while I was on the phone, I was sick, and then she just called the ambulance. But they've given this now.
Let's have a look. How are you feeling now?
Still on and off. Like, I'm getting hot flushes. I can feel like just steam coming out of me.
Yeah. So you think this is probably panic attack? Yeah.
I don't know. I don't know.
Let's check. Give a few checks today. Check your temperature, listen to your chest, and look at your throat and see what's going on. and take it further from there. Just going to no, you don't. It's not panic attack. It's your temperature, 38.2. So that's why you're shivering and feeling very cold and hot and sweaty.
Right.
It's a big I don't tend to use this, but I may need to because you're not opening your mouth big. It's a big okay, that's good. Quick listen to your chest. Thank you. Oh. The chest is all below clear, and the upper airways, there's some harsh breath sounds. You're coming down with a viral illness, and that's why you're feeling this way. The throat can become much more sore and dry, and you'll have mucus coating as the hours pass by, and you feel a lot more unwell as well. So start taking Nurofen and paracetamol. Drink plenty of fluids and take good rest at home. There's nothing else sinister or serious going on as such. Yeah, and it's not panic attack or anxiety attack.
Okay.
Is that okay?
That's fine.
Yeah, you're feeling miserable and awful, but hopefully things will get better. Okay?
Thank you.
All the best, man. Thank you.
Hello, Dr. Morris. Thanks for waiting. How can I help?
I've got two things
Uh-huh.
in my foot. I've used the wart cream as well.
Yeah, okay.
And
Yes.
this one is quite
Yeah.
painful
Yeah.
as well. And
Uh-huh.
same as
Yeah,
this one.
okay. The treatment for this is to buy something called duct tape. Or duct tape. And you put it on, cut a little piece off, put it over it, leave it on, and usually within 2 to 3 weeks they go away. And it's twice as good as the stuff from the chemist or freezing it or anything else.
And I can find it on the
So, okay, good question. So a hardware store, places like, B&Q, Wickes, those sorts of places. You need a smear. You know a
I
smear?
need a smear?
Yeah, that's what it's saying, you need a smear.
Oh, it's been 5 years now.
Well, it's every 3 years you need it.
Is it?
Yeah. If you make it put on the way out, that'd be great. For that. Okay. Sorry. It's best to have one though.
Thank you very much.
Okay. Bye-bye.
Hello, sorry to keep you waiting, my lovely. How can I help?
Good afternoon. Come and have a seat, sir. Hello. So, how are you today? How can I be?
My little boy,
Yes.
He got a white spot in his pupil, a left eye. He had been checked. We went to the Oxford Eye Hospital. He sent the fax over here and the post as well. So we want to discuss with you.
It's just on the left that you're noticing?
Yeah, left, yeah.
Yeah, I think it might, but not necessarily be that you can get something called a congenital cataracts.
All right.
So they get like a whiteness, which I think is what you're seeing. So I'm going to write a referral.
Oh, all
so
right.
you should get something in the post.
Okay,
At
from
the
the eye specialist.
From the eye specialist, yeah.
Basically, looking at this, it's not just the cataract. Behind there is blood vessel formation and hence not a completely developed eye. And nothing sinister or cancerous, but he has advised against having a surgery. But I totally understand your concerns about whether there will be somebody out there else who could give a different opinion for a different, better prognosis and outcome. Initially, what he says is that by doing surgery, there is a risk of the back of the eye retina to detach, and that causes blindness.
I take it you're going to abuse me with your needles.
Yes. Torture time. Okay, just try and relax that leg. Just let it flop as much as you can, okay? Prick now.
Are you here for another injection?
That's right, yes.
Yeah? You must feel like a pincushion, do you? All these injections.
You make yourself comfortable because I'm about to shock you with the needle.
Can you take blood without needle, please?
Okay, sorry. Didn't even flinch.
It feels like nothing.
Exactly, that's how it should feel.
Oh dear. In we come. In we come. No John today? Have you got your new teeth?
Yes.
God, they're much better than the old ones.
I know they are.
You look great. Are you happy?
Yes.
I think they're great. Oh, that's very
Thank
kind
you.
of you. That's very kind of you. Let me get this chair out. I've known Peggy for probably 17 years. As soon as I started the practice, I got to meet her. She suffers badly from quite extreme osteoarthritis, which has affected most of her joints over the years, particularly her back. And when I started doing acupuncture as a treatment, then she seemed to be a perfect client for this type of treatment.
Before you start sticking me, this calf
Yeah.
has really been hot and swollen.
Yeah?
And but I don't know whether I've overdone the gardening or what I've done.
How long for?
Well, it's just about cooling off now.
Okay. When do you mean by that? Do you mean for the last?
4 days.
Right.
And I haven't been able to do a lot with it.
You can't remember doing anything to it though.
No, oh, definitely not. No.
No.
I've been doing a lot of gardening. I'm just wondering whether I...
You didn't feel a pull or a snap or anything like that? So I've been using acupuncture now for about 15 years. I attended a course and was a little sceptical after coming out, but I gradually introduced it to my surgeries, and over the years have found that 70 to 80% of people get some effect from the treatment that we give them. If you can cut down on medication, if you can reduce their pain levels, then I feel that it's a successful treatment. God, and the hair's been done as well, hasn't it?
Yes. Very noticeable today, aren't you, David?
It's not routinely used under the NHS unless you go into a specialist pain clinic or physiotherapist normally. In fact, I think there's only 2 of us in Slough who offer acupuncture as a service, and we do it off our own bat. Okay, let's have a look. Okay, so nice and relaxed, just let everything flop.
See, that hurts. That really hurts.
So all over if I
Yes,
do that, yeah.
yes.
Any specific point or not?
All
Just
that.
all of it?
All that.
All of it, all the way up and down?
Yes. Yes.
Okay, that's your muscle, isn't it? That's...
Is it? I want to talk about my toes. That one there now,
Yeah,
that's coming over here.
the overriding one, yeah.
And this one is coming over.
Okay.
Like that. So do I have to phone up and speak to him, or do you have to...
I'd have to refer you.
Yeah.
I mean, the problem with that one is that you've still got a bunion of sorts here. Do you know what
Well,
I
I
mean?
haven't had that done, have I?
Exactly. So it's in that direction. So this is a reasonably straight toe, but it's
Yeah.
this one's popping underneath it,
Yeah.
whereas that is just the most disastrous looking toe I've ever seen. Well, it takes a 90-degree turn, doesn't it?
Yeah, it
there.
does.
So
Yeah,
it's
yeah.
so that's very different. So that would be to do something with that joint.
Yeah. Well, I'm quite happy to have it done.
Whereas that one would be, I would be tempted not to do anything with that.
Okay.
Okay, because I think that would involve having to do this whole foot.
Yeah, and I don't want that done before I go away.
But that I think probably needs to. Is it causing pain?
Yes, and especially when I've got shoes, and I can't back to square one again. I can't
Yeah.
have proper shoes on.
All right, madame. What have we got there sticking out here? Yeah, 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 yeah.
So I'll see about 5 to 6 weeks.
Yeah, I will. So we'll send that off to you, and we'll get you back in
You're
again.
after the-
Yeah. Look, let me help you. Well, what you're doing?
Going with it, sir.
You haven't had a gin today, have you already?
No.
No. Okay.
Okay then, David. Have a lovely holiday.
I will.
Look after yourself over there, please.
I will.
If we don't operate, he might be left with a reduced vision
So
on
that's
the
when he
left
still can
side.
see.
You can still see. Right side is absolutely normal.
Yeah, I know.
People can function with one eye, but obviously, as a child, you need to want to make sure everything is perfect with your little one. Patients rarely ask for a second opinion. They usually trust the judgment of the doctors. In the John Ratcliffe Hospital, the consultant discussed with the parents the pros and cons of doing a surgery to restore the vision. The parents were told that by doing a surgery, there is a likelihood of blindness. Because of that guarded prognosis, the specialist told the parents that not doing an operation might help the little one. Hence, the parents came to see me for a second opinion. Yeah. If you do the operation on such a small eye now, there is always a complication of bleeding and the retinal detachment, and that causes complete blindness. So, whenever the surgeon is putting his scalpel or procedure anywhere, he weighs the options, benefits versus risks. Based on that, they give the advice. But there's no harm in getting a second opinion. Yeah. Parents are always anxious about and want to get the best outcomes for their children. As a parent myself, I feel the same. Getting a second opinion gives the patients extra element of reassurance. If I put myself in their shoes, I would think it's perfectly harmless to try doing that, because following the first opinion may not achieve the best outcomes for them. Hi, this is Dr. Nanda dictating a referral letter to consultant ophthalmologist in Great Ormond Street Hospital, London. The assessment and the first opinion is very detailed and clear. However, the parents are looking for further second opinion with a view for enhancing the overall outcome for the left eye for this little one, and hence this referral sincerely. Okay? So this will go, and the secretaries in the next 1 or 2 days will fax it across to the Great Ormond Street Hospital, and you should be getting a letter in the post within the next week or two. And I'll contact you on Friday after speaking to the Great Ormond Street Hospital as well. Is that okay?
Yeah, that's fine.
All the best for your little one, okay?
All right. Thanks a lot for your help.
Not a problem. Take care. Okay.
Yeah, thank you.
All the best.
How long have you suffered with psoriasis?
Quite a long time.
Okay.
But it's never actually been that bad before.
Where does it affect you normally?
It normally just affects me here, but now it's started showing up here.
Yeah.
Started showing up on my other arm.
So you've got it on your trunk, you've got it on your elbows, I can see. Have you got any sort of in your groin area, genital area?
No.
No? Any in your belly button?
No.
No? Okay. Your ears are okay?
Yeah.
Hair or scalp? Any problems with that?
No.
No? Okay, good. How do you normally manage this?
Well, I've been using creams in the past now. Like, just ain't helping no more.
So there are some other things we could try which you've never had before. So one of them is something called Dovabet gel. Does that ring a bell?
No.
So I will give you something that will help to try and accelerate the clearance of this. But it is still important you use a regular moisturiser to soften the skin, because it's what psoriasis is over-thickening of the skin. It's sort of almost, you could call it a defect. It's almost healing and thickening up too quickly. Usually if you do that once at night before you go to bed, that should be enough. But then you need to look into moisturising straight after doing that. Have you used Vaseline, that kind of consistency on your skin? An ointment?
A lot of Vaseline contains like nuts and stuff, and I'm allergic.
Okay.
So I don't want to be rubbing that on my skin and having an allergic reaction.
Vaseline doesn't contain nuts. It's a petroleum jelly. Have you used it before and had a reaction? It's basically an oil-based product as opposed to...
Yeah, there's like lots of different Vaselines. Like
Okay, so what I'll do, I will give you 2 things that I think will be best for you to try. If it works, then it's great. All right? And then I'll need to see you back to see if you're agreeing with it in terms of it's suiting you or it's making a difference.
All right.
Shall we do that?
Yeah.
Okay, see you soon.
Hello, darling.
At 8:40 with the nurse.
Right. Blood test or
Blood test.
Hi, June. It's not. It's not a permanent move. It's just for this morning. So is it better for you being this close?
Well, for me it will be, but I mean, I'm just one. I'm staying here.
Okay.
This is the appointment you told me not to cancel.
Good.
I am slightly worried about my theophylline level, having been told it's gone over 20. And my shakes are getting pretty every day.
June's main problem is chronic obstructive pulmonary disease, COPD, and the problem it's given her over the years has been progressive shortness of breath to the extent that this now is limiting her life. June is on quite a lot of medication. Theophylline has an anti-inflammatory effect to open up your airways, help you breathe a bit better, and also an effect to relax the muscles that we've got in the bigger airways in the chest and in the bronchioles. The problem with this is that if you give someone too much of it, you get too much of the effects. So your blood pressure goes up too much, your heart beats too fast, and you start to feel really quite unwell. Do you think the shakes are caused by the theophylline level being high?
Well, I take my tablets at 8 o'clock. The shakes start. It's like a caffeine rush, you know, when you're shaking inside.
Yeah.
And I've noticed recently, which is unusual, that after I take the theophylline at 8 o'clock at night, for about an hour I get slight shakes again.
How's the breathing been?
It's not as good as it was. I mean, at this time, with this steroid course, it's gotten a lot better. I don't know if it's just me, but I think it's beginning to creep into getting worse again.
What would you like to do about the theophylline level?
I'm in your hands on that one. I know it's a dangerous drug.
It comes down to the fact you are having side effects. Would you like to...
I'm capable of putting up with these side effects until I finish my steroids and see how we go on that one.
Right. So that brings on the issue about tapering off the steroids. We often use steroids for conditions in which we want to damp down a patient's inflammatory response, such as eczema or asthma or chronic obstructive pulmonary disease. Steroids, really useful drugs when used properly in the right dose. We do worry about patients who have higher doses for longer periods of time because that's when you then start to have the side effects from them. So what do you want to do about that this time?
I really don't know. I haven't got a clue. I cannot cope with not being able to breathe, to look after myself.
I can only imagine how bad that must be.
Because what I find at the moment with the steroids, it gives me the get up and go before it affects my breathing getting better. As my breathing, shortness of breath gets worse, my get up and go disappears out the bloody window. The fact that I can cope with it goes out the window. It's a bit of a vicious circle.
Are you still having pain now?
No, it's eased off now.
It's
I
eased
say
off
that's
now.
why that pain was. So I've not had it for about maybe 4 or 5 years. That sort of pain.
Really? So it's more severe than usual?
Normally it just goes, and I take my spray and it's gone.
What time roughly did it happen then?
I would say about 5 to 3.
5 to 3, okay, fairly recently. Yeah, okay.
I phoned the hospital.
And prior to that, you said you don't normally get pain this severe.
No.
How often does your angina pain normally affect you, though? Is it something that do you normally have to use your spray most weeks?
Yes, normally I have to use my spray. I go through quite a bit. Because I'm waiting to see the heart specialist.
Okay, fine. Apart from your inhaler and your usual medications, have you taken anything else today?
No, the only other new medication I have been taking is I was on citalopram, 4 milligrams,
And this pain, when you had it, did it move up to your neck or down your arm, or did
No,
it?
my arm went stiff. I know that. That happens.
It went
quite
stiff.
It happens quite often that way. That's why I took my pressure.
Okay.
Straight away.
So listen, what I'd like to do is do your blood pressure.
Right.
Have a listen to your heart.
Yes.
But I think what we also ought to do is get an ECG done. Yeah, you know what they are?
Yes,
the
I've had it,
stickers. Yeah. So one of my colleagues down the corridor will do that in a second. Let's examine you first, okay?
I really thought I was going to black out. That's how bad it got.
Really?
A double vision. That's not bad for me.
I mean, that's good.
Yeah.
But I'm still a bit worried.
Yeah, I know that.
Okay.
I'm
Especially
really
because you know in yourself what is a normal angina pain, and for you this was severe, wasn't it?
This is severe.
And it sounds like it's been happening fairly often recently as well. I think today we need to do a blood test in hospital.
In hospital?
Yeah. So there is a blood test that we can sometimes do called a troponin, because sometimes you can get things can become unstable, and you know I really don't want you to have a more major episode than this weekend. Okay. So let's get an ECG done, and then we can have a chat about giving the hospital a call and getting you seen there today.
Okay.
Yeah?
Yes, sir.
Okay. So if you just stay here for a second, I'll just confirm which room's free to have it done. All right?
A couple of days ago I started getting chest pains all around here. And then it started happening again today at work, and then I started getting pain down my arm.
Lovely, let's have a listen to the heart.
I saw you were admitted to A&E because of your heart racing. Is that right? Yes.
I think I can see a surgical scar over
It's
here.
an aneurysm.
Okay.
Are you having any chest pains now?
No, I'm not having chest pains. The only feeling that I have is this of missing of heartbeats and then a discomfort feeling, that's all.
Yeah.
Okay. Thank you.
Thank you.
All right, let's have a look at this. So, looking at your ECG, I think we still need you to be seen in hospital today, okay? So what I'm going to do is call Wexham Park, let them know your story and what's happened today. Okay. Hi, it's one of the local GP registrars in Farnham Road Surgery in Slough. Hi, I've got a gentleman with me who had a particularly severe episode of angina this afternoon. He is known to have ischemic heart disease, but this was a particularly severe episode for him and more prolonged than usual. So I think really he probably needs to come in and have a troponin and a repeat ECG. Okay. Thank you. Bye. I'm going to give you a letter to take with you as well.
Thank you. Okay.
Okay?
Thank you for all your
I wish you all the best.
Thank you very much.
All right.
For all your help. Thank
No
you.
problem. Take care.
If you wanted an ambulance for cardiac arrest, which this is, here from the surgery, what's the number you're going to dial? You need 9 for an outside line, then it's 999. In the heat of the moment, people forget things. Different places may need 9 for an outside line, some places don't. Let's do compression then. One hand, centre of the chest, other hand on top. Get yourself comfortable. Go for it.
It's a bit of a vicious circle.
And is your breathing okay at the moment on the floor?
Yes, it's okay at the moment and I'm coping. And then you keep finding things.
Yes.
It's not helping.
Not helping, yes. Maybe we should just stop looking.
I think you should. I keep telling you this.
Yeah. Patient's always right. We should listen to you, yeah.
I've got to last until my Charlie gets through medical school and graduates.
Okay, when's that going to
And
be?
at least one of my grandchildren gets married.
So what are we talking about? 10 years?
Yeah.
Okay. 10 good years, not 10 years of being looked after, but... Yeah.
No nursing homes whatsoever.
Mm-hmm.
I'd rather die than go there. So, yeah, quality of life.
Right, okay. So the plan, then, is... For the moment, let's keep on the same dose of theophylline and just see how you are with the side effects, and we'll repeat the blood test and make sure it's not creeping up. Do you want to come back next week and see how you are and discuss it again?
I think, to be honest, that's too soon.
Okay, 2 weeks.
Yeah.
Okay. Is there any chance you can actually read my doctor's writing there?
What the hell did they say about you at school?
Yeah, but that is my absolute best.
Almighty. Do they teach you to write badly?
There's 3 reasons why doctors write badly. Number 1, we rush. Number 2, we can't spell the medical words we're writing. And number 3, if you can't read what we've written, we can always say it's something else we wrote. Yeah, that's why it's all typed now, so you can't deny what we've written. And it corrects the spelling for us. So.
Right.
Okay, nice to see you. See you 2 weeks' time. I hope things settle down for you.
Okay.
Okay, take care. Bye-bye.
Bye.
Hey, you're right. Is it right to put this down?
Yeah, completely. That's fine. I'll have a seat.
Just basically, I just booked this appointment because I had it's called medical yesterday at work.
Okay.
And come out on my hearing test was pretty bad, and they said maybe we should come in and advise with a GP. I thought come and get it out of the way.
Okay.
It looked scary. Basically, I just looked at this in category 3, and I was just like, well, that must be bad.
Okay.
And obviously, I have a few people at home, your hearing's not so good. They're always telling me.
Yeah.
Maybe I should do something about it, kind of thing.
Okay, so how long have you noticed that it's not been so great?
I ain't really noticed.
Okay.
It's everyone else. That
So
really
you don't have a
notices.
problem?
I don't really have a problem.
Okay.
It's just sometimes I do struggle to hear certain distances and stuff like that, but it ain't really bothered me up until the point of having this check, really.
And have you had any problems with your ears earlier on in life?
No, but my family have.
Hearing loss can be hereditary or it can be acquired. That's why it's important to ask about a family history, as families have many things in common, such as genes, their environment and their lifestyle.
My brother, he's had his grommets done, and my dad's got bad hearing, my sister's got a hearing aid as well.
Okay.
So, yeah.
Fine. Okay, so I'm going to have to take a look inside your ears.
Yeah.
So what job do you do?
I'm a binman.
Okay. You are at higher risk of developing hearing loss if you work with noisy equipment. This is known as noise-induced hearing loss and occurs when there's damage to the sensitive hairs which lie within the ears. Just have a look in one, sorry. There's definitely no wax in there. Sometimes that can cause a problem.
That's what I originally thought the problem was.
Yeah, and I can see down to the eardrum.
Right.
And they both look okay. So don't know what's going on. So what I'll have to do is I'll have to refer you to the ENT specialist for them to investigate this further and see what's causing it. Okay.
Yeah, that's fine.
All right.
Will I get a letter or...?
You'll hear from them directly. Okay. So anything between 6 to 12 weeks.
Yeah, I appreciate that. Thank you very much.
Okay.
Happy everything, yeah?
Yeah, that's fine. Take care.
Lovely.
Bye-bye.
Cheers.
Bye. Bye. See you later.
Thank you very much, Doctor.
Bye-bye. All right, thanks.
See you, mate. You take care.
No problem.
Bye-bye.